Hi, everyone. Welcome back to the Scalable Practice Podcast. I'm Marina.
And I'm Jess.
And today we're going over patient retention strategies when it comes to their very first visit in your office. Last week, Jess and I held a live strategy session. It was actually a really productive, awesome session. Great to see everyone. We had all kinds of practices in the room with us, from dentists to chiropractors to physical therapists, mental health therapists, and essentially we workshopped patient retention strategies. So when it comes to our live strategy sessions, some of the things that we prioritize the most are actually more of the framework for how you understand which tactics to implement at which point in your strategy. So we do go over all different kinds of tactics, all different kinds of strategies that we try with our clients. But on top of that, we really try to show people how you apply this most effectively to your practice and your current marketing system. So on the live session, we had worksheets and workbooks, and people were, really taking notes with the numbers and the information and the data that they have from their current practice and systems. And then from there, we went into strategies. And so for the episode today, I felt that it would be really wonderful to share with our larger audience some of the strategies and tactics that we use when it comes to improving that first patient experience, because it's ultimately so important for retention, that is not just done well, but also done strategically. And so what I wanted to do today is go through some of those strategies when it comes to first patient experience. And Jess is the one, the mastermind behind putting all of these things together. So she has a really great way of walking through it. So let's get into it.
Okay, so like Marina said, we're going to be talking onboarding through that first patient experience. And I like to tell people that, technically, onboarding is more patient acquisition, less patient retention. But in the landscape of people we have right now that are coming into our practices, they're visiting, and our patients and clients, things like that, their very first impression has to start at onboarding. So gone are the days when you just call up and make a phone, call and make an appointment and just show up to that appointment. Now we live in a very digital world where we are bombarded with information, and you have to be on your game from the very first interaction that they have with you, including your onboarding. So onboarding, there's a framework that we've found that works well for this. And if done right, it really sets that first patient experience, that first visit experience up in a positive way right from the start. I don't know about you guys, but if you've ever made an appointment and then you just get this email that's like, please fill out these forms, and it's just, all of your insurance forms and things like that, that's great because it saves you time. But that's very standard practice now. So it's not, now you have to go above and beyond that, because that is standard practice now to just get that sent. So this phase in the patient retention journey is everything from onboarding to their first visit experience, like when they leave from their first appointment or visit, if you're virtual or whatever, when they leave you. So the first thing is the goal of onboarding now is to continue to inspire and reinforce that they made the right choice to see you. So again, they already went through the first phases of finding you and deciding they want to work with you. This is your chance to really enforce that and make them excited for their first appointment. Obviously, you want to make sure that you're collecting the right information when you're booking their appointment so that you can have successful outreach and that your systems allow for the right communication beforehand. So you have, their email, their phone number. Well, I guess those are just the basics. We want to make sure we have their email and their phone number because we want to reach them in both places. Now, where people are in a digital world, some people, you have to be able to reach them in both, because some people will not check their email. Some people are going to not see your text. So you want both. And the goal of this now, we literally are seeing competitors win over other practices purely because their booking process is easy. And the new generation of people, I mean, not even new generation, even, my generation, I don't always want to call. I want an easy booking system. If I have an option, I can book online or I can call. Um, the easier the better. So that's one thing. If your booking process if there's ways that you can simplify it and make it easier. Nowadays you can text. That's the most effective way I've seen right now with appointment booking is if you can text, and it's texting with the front office to book that appointment. I mean, as we are knowing now, people are just more lazy. So the easier we can make that process, the better. And there also, the other thing is it's not as hard as it used to be to implement these systems. There is tech that works seamlessly with your systems to allow this and make it possible. So it is, while everything is tech oriented, it's also getting simpler with if your systems work for you. Okay, so the welcome communication in email and text should be more than just forms to fill out. And I'll get into what that should be, but you always want to make sure that that language is about them and not you. So people do have choices now. And like I said, this is their first experience with you. This is setting up their brain for how the whole experience is going to be working with you. So if the first message they get says, please, or your doctor wants you to fill out these forms before you get here, that's saying that the doctor wants this. So if we reframe that and we say, welcome to our practice. To save you time when you arrive, please, fill out these forms before you come. It changes it to now it's about them. And honestly, that's what society is right now. It has to be about them and in, benefiting them for some reason, for them to be able to want to give you their business. So the other thing that you guys can use with this right now, with your onboarding, is take advantage of the opportunity to communicate with them and do a welcome sequence instead of just a text to fill out forms. You want their onboarding done. You want that information ahead of time, insurance and all that kind of stuff. You want to do all of that ahead of time, but take this opportunity to do a welcome sequence with them instead of just sending those forms. So right after they make their appointment, they should get a welcome text and email sequence initiated. And this should include a introduction to your clinic. It should include an introduction to the provider that they're going to see. It should include, and just to preface this, not everyone is doing this, but if you want to stand out from what all the other practices are doing, this is something you can implement that will significantly make your practice stand out to people, to new patients, and make patient retention down the road easier. It might seem over the top, but now you have to be ahead of your competitors, and this is one thing that will set you apart. So instead of just sending the forms, send a welcome sequence, which will include an introduction to the clinic, introduction to the provider, and the treatment that they're going to be getting. Also, this is an opportunity to let them know the other things that your practice offers, setting them up to potentially ask questions about a different service that they could add on or something they've been curious about. And this can also prompt them to connect on social. We're going to talk about why that is so important, but this can serve as so much to make your job down the road way easier if you take advantage of a proper onboarding system. And then you'll also have an educational email, if possible, depending on the timeline between their booking the appointment and coming into the appointment. And then, of course, your appointment reminders, texts, calls, confirmations, making sure no-show rate goes down by having just a simple reminders and having them confirm that they're coming. Okay, so going into what actually does an unforgettable first patient experience look like? There's a lot of things pulling people's attention, and we went over in our live strategy session, we did cover the reasons that patients don't come back. And one of the things we talked about is just there's so many distractions. They're seeing so many things everywhere else that we have to step up our game. And one thing is creating that unforgettable first patient experience that they want to share about, that they want to tell people about, that wants to motivate them to come back. And studies have shown that if you get a patient back for 3 appointments, their retention jumps 80%, that they will keep coming and be a loyal patient to you. It's like that 3 appointment is like the magical number. So the goal for all of this is to run them to that 3 appointment rule, is what we call it. So as we're creating that unforgettable first patient experience, yes, it seems over the top, but the goal is to run them to appointment number 3, which is our big focus. So keeping that in mind, that helps shape what your first couple of appointments look like to get them to that 3rd appointment mark. Okay, so what will make this part of their day stand out? You might think, I mean, I have never been like, oh, yay, I get to go to the dentist today. Like, this might not be the best part of their day. But I can tell you that I do love going to the dentist office because the people know my name. They know what I'm doing in my life. We've connected in other areas. Like, it is a pleasant experience and it makes it so much easier. I mean, I love my dentist anyways, but in general, if you're not going to if what you're doing isn't the highlight of their day, there is still so much that you can do for them to create that good experience. So what is their experience like within the office? Again, I know some of you are thinking, wow, this is way over the top, but this is what your competitors are doing to stand out. This is those experiences that you can give them that will make them want to come back and tell their friends about that experience. So what do you want them to feel when they come into your office? What is the vibe? What is the atmosphere? I'm not just talking like, is it pretty and do you have nice chairs and, a pretty setting? Are they welcomed in and there's a sitting room with a beverage or a water cart? Is there an area for children to be entertained? Is there, what is that environment like? What are we welcoming them into? The other thing is you always, and one fun tip that I heard someone say that one of our clients implemented is they created an area in their front room. Like you can get creative with things like this, but they created an area in their lobby that was a photo spot. And it had like this really cool mural on the wall. And they had a little sign with like take your picture here and share. And they had just a really cool area in their lobby that encouraged people to take pictures and share it and things like that. So you can get creative with what you're doing. The other thing is they should always leave with something in hand. And I don't just mean an invoice or a bill. I mean, they should leave with something exciting in their hand, whether that's a care progress card or a punch card, or you always want to include their treatment plan. We'll get into that later, but they should also leave with some type of welcome gift. And that can literally be a coupon from a smoothie shop down the street, or it could be a branded chapstick. It could be some type of swag. Anything, they should leave with something in their hand as like a welcome. Thank you for coming to our practice. We appreciate you. And if it's something that other people are going to see, even better. If we're giving out a hat or something that's branded that can get your advertising out there, that's even better as well. Okay. The next thing is you want to make them feel confident that they're coming in for a personalized yet strategic process. So you want them to feel like you do this 500 times a day, but that they are specifically special and that their experience is unique. They don't feel like another number, but they're guided through every step. We make sure we're telling them what's going to happen. We are guiding them even just through the office. I've been in some offices where it's kind of a maze back there. And if someone just is like, oh, we're going in room number 3. And I'm like, well, where's room number 3? Like guiding them, telling them like, oh, this is what we're going to do today. You're going to sit in here for about 5 minutes and then we'll come back or whatever. Guide them through. Studies show that confused patients rarely return. And some of your guys' appointments are new for people and they're scary. Or, again, bringing the dentist's office up. Not everyone loves going to the dentist's office. So if you can make that process clear and ease any confusion that they might have, you have a better chance of getting them back. Okay, so moving into the next thing of creating an unforgettable first patient experience, we'll roll into your team. So you really are only as powerful as the team that you have working for you. And I know everyone knows this. Your team that works with you is really your patient retention MVPs. They are so much more than just service providers. Even your medical assistants, your front desk, your everything, your everyone, those people are the ones that are going to make the connections for you. Um, Depending on the practice that you're in, if you have a lot of people working for you, or let's say you are a dentist. I keep going back to dentist example today. If you are the dentist, you are with the patient less time than the rest of your staff. So your staff has to be completely on their game of making that connection and creating that environment that you want. So we call this the team power strategy. And we actually train private practice teams on how to make this part better for their practice. But just the quick breakdown of it is we're reframing their role. Your staff isn't just offering a service; they're your patient retention MVPs. They should be like trained appointment bookers. Like they should be getting those people booked before they even leave your office for their next appointment, and be relentless problem solvers. They don't have to be pushy and make it uncomfortable, but if someone says something like, I don't know my schedule right now, we can say, oh, that's fine. Let's go ahead and snag this spot. And you can always call us and change it if you need to. Like, just be relentless in the problem solving and have them basically overcome any obstacle to get that appointment booked, which again, remember, we're running to appointment number 3. So that's critical that the people spending the most time with your patients or clients are creating that connection, booking those appointments, and building that vision for those people. Okay, so a few other things going into the framework for this. Again, this will all vary based on your individual practice, how you see them. I know I talked about when they first walk in the door. If you're virtual, that might feel a little bit like, okay, well, what can I do for that? There is always, we help, we live in a world where a lot of services are virtual right now. So we do help strategize on those things too. But an example for a therapist that was virtual, what we had them do was they had a book recommendation that they wanted all of their they recommended to all of their clients. And so we made it so that as soon as the person was done with their appointment, they could put in their information to have their book delivered, so they could have a hard copy of this book. So it wasn't necessarily in their hand, like literally, but it was, they were still leaving with something. So obviously take everything we're saying into relativity for your practice and how you can implement it. But this is the basic framework for the things that you want to have in there. The other thing, you always want to have a way for them to follow you on social, and not just a way, but also an incentive. We like to have our brick and mortar, like in-person clinics, have a plaque on right by their desk that has a QR code, and that they are helping people. Oh, go ahead and scan this and follow us on social. We do giveaways for everyone following us on social, or anyone that follows us on social, we're going to give 10% off their next treatment or whatever. Give them an incentive. You can include them following you on social as part of their onboarding. You can include it other places, but you want to get them following you on social. A big, I mean, social's just inevitable right now. You might think it's just it's not for your practice, but your clients are there. I was sitting in the waiting room of a lab at the hospital yesterday, and I pointed out to my husband, I was like, people don't think all age groups are on social media. And I looked in this lobby, and not kidding, there was someone from every generation sitting in this lobby scrolling on their phones. Now, I don't know what platforms all of them are on because I wasn't looking over all of their shoulders, but they were all on some type of digital platform. And if you're not there, someone else is going to steal them because they are seeing this stuff on digital platforms. So you want to make sure that they are following you on social platforms, and that you've done your research ahead of time to know which platforms those should be, and give them an incentive, because people now, we don't just follow just to follow. We follow because it's giving us something. People are lazy and they want incentives. So just make that easy for them. The other thing is, your office needs to handle the follow-ups. So you never want to tell a patient, let me know in 2 weeks how it's turning out, or if you need a touch-up. Let's say if someone comes to you for Botox, your office would say to them, oh, we'll follow up in 2 weeks and ask you to send us a picture so that we can make sure your results are exactly what you want. Your office should be doing that follow up, not expecting them to do that. And you can create a system where your follow ups also provide value to them. There's a lot of ways that you can make sure you're connecting, but you want to make sure that your office is handling and is responsible for the follow ups, and that your team is taking enough notes so that that's segmented. They're not getting a follow up saying, how was your root canal, when they came in and they had teeth whitening. You want to make sure that your follow-ups are segmented, and that your office is doing them, and that they're telling the patient when they are at their first visit that they will follow up and what they're going to follow up about, so they know what to expect. Another thing, and this is back with social. When it comes to patient retention, there's a lot of things you'll hear about, texts and emails and things like that. And those are all more of a personal connection, a personal touch point. Social, like I said, everyone is on social media in some form. And if you're there, that's a really like a less intrusive way of connecting with them and staying in front of them, because you're not directly sending them an email or a text. You're in the space that they're already in. And it's a way less intrusive touch point that's keeping you in front of mind, and keeping you spending time where they are. And the last part of the framework is have them booked before they walk out that door. There's a lot of things that factor into that 3 appointment rule, but we always encourage our clients to structure their appointments in a 3-part series. But if you can't, either way, they should never walk out your door or leave your virtual appointment without having their next appointment booked. And that's kind of that's like a success measure, is how many appointments are getting booked before the appointment is over. So that's like the last part of the framework that you want to make sure happens just for their first patient experience. And then obviously it leads into the next phase of what happens between first and second. But to just create that first unforgettable patient experience, if you nail this part, then appointment number 2 and appointment number 3 are much easier, because you've set the expectation. I mean, you still have to be on your game, but it's much easier to keep them if that first initial experience set the bar for them as to what working with you will be.
I mean, it's kind of like
will be
it's
like.
kind of like dating. Like
Yeah.
if the first date isn't good, you have no hope for the second and third. But if you can screw up a little on 2 and 3 if you did okay on the first one, or spectacularly on the first one.
Right.
So lots of different strategies and techniques there. The thing that we love about this portion is that these were all like very little to no cost things to implement. I mean, nothing that just talked about is huge overhaul in terms of cost or time. It's just actually doing them strategically and setting them up. That's why we always say there's a lot of hidden revenue in patient retention, because unlike patient acquisition, where typically you have to spend money to get patients, you can really increase the amount of money that patients are bringing into your practice without spending that much more to get them, because a lot of patient retention is just low budget. It's just knowing what to do and when to do it and how to do it in a way that stands out. I don't know if you mentioned, Jess, did you mention about our client that had like less than 20%
No,
of their
I
patients
didn't
following
mention
them on
that.
social? I just think that's a really important point. So we had this one client, we did some digging into their followers, and they had less than 20% of their current patients following them on social. And like Jess said, social is a super non-invasive way to get in front of people. We're a little inundated with emails and texts nowadays, but if you can see them on social and they're able to be reminded of you and build credibility and all of these different things without feeling stalked or bothered, it's absolutely something you want to take advantage of. So just to reiterate the importance of making sure when they come in for that first experience that you can get them on social as much as possible.
And we do get a lot of questions about that with HIPAA. Like people will ask a lot, like, am I breaking HIPAA if I'm following them on social or things like that? And if you aren't directly saying like, hey, it was great seeing you yesterday, or asking them how their appointment was or anything, like I follow several dentists, I follow several med spas, it doesn't mean that they're your patient. So you're not breaking any HIPAA violations by them following you and connecting on social. So you don't have to go out and hunt down their profiles and follow every single one of your patients. That's why you want them to be following your account, and so that you can make that connection and you're not breaking any violations.
And I think having, like we said, not just making it easy, but also a reason, having discounts or deals that are, exclusive for social media followers just helps people take that one little extra step so you don't have to.
That same client that only had 20% of their client base, and we're not talking a small client base, we're talking hundreds of thousands of patients, because this practice has like multiple locations and things. We implemented social following only giveaways, and their their direct website traffic from their social media has gone up about 5,000% since we implemented their social specific giveaways for their followers, because now the people are catching on. Oh, they're going to give away a whole skincare regimen next month. So I got to be following on that. And they have to be following on social. So, and again, they leverage their team at their front desk. They now have their plaques and they're having them scan it, and they get on and then they can enter the giveaways. So it has skyrocketed their conversions from social to website by 5,000%, just implementing something simple. And then you're like, oh, but I have to come up with a giveaway every month. I know that you guys have vendors and plenty of people that are willing to give freebies for you guys to give away. Like, again, Marina said, this is like a low cost option to gain big traction. The other thing I wanted to point out too is, like I said, this crosses over between patient retention and patient acquisition, because these are things you need to think of for getting new patients. So it's like the other part of it's like the very beginning of patient retention. But we also have a lot of really effective strategies in our other phases that are for patients you have now. So if you're thinking, well, like, oh, I wasn't doing all of that, so now I'm gonna not be able to keep all of these patients for patient retention. We have a lot of strategies you can do with the patients you already have to get them back in and to kind of keep them coming, that are also low cost or low or no cost, just actually focusing on it.
Well, and so just like Jess mentioned, this is only one phase of this sort of 7-phase framework that we look at when we're overhauling marketing strategies for our clients. So what we've decided to do is go phase by phase and give you the why and some of the what on what you can do to improve each phase of your patient journey. So I believe this one is 4 in that framework. We're starting from in the middle. 4 is really kind of where patient retention begins. 1 through 3 is more patient acquisition. So stay tuned for our next episode. We'll be going over 5, 6, and 7, as well as backtracking and going back to 1, 2, and 3. So if you found this valuable, please subscribe anywhere you get your podcasts, and we'll see you on the next one.